A very good morning to all of you. Today we have with us my friend and colleague, Engineer Mission Lokat. He is the chairperson of the Public Grievances Department, NPCC. He has some very important things to share with you all. Also with us is our Dimapur DCC President, Mr. Kutoho. And on my left, on the far left, is Mr. Andrew, Media Coordinator, NPCC. Let's start with our chairperson of Public Grievances Department. The time is yours.
Okay, sir, thank you. Okay, today we really want to focus on 2 points about health and family welfare department in Nagaland. So the number 1 point is lack of basic equipments that are required here in Nagaland. Okay, lack of basic equipments or material equipments that are required in the medical sectors here in Nagaland. And the number two is lack of medical staff like doctors, nurse, radiologists, technicians, all those. So regarding the first one, lack of basic equipments that are required here in Nagaland. Regarding this issue also, the first thing that I want to mention is last year on 4th of May 2024, we gave a press statement to the Naga Hospital Authority Kohima, telling them to restore the CT scan and mammogram at the earliest. But still then, till today, as of now, they have not restored the CT scan also and mammogram also. Now CT scan, ultrasound, all those are basic equipments that are required in a hospital. And it's not only Kohima being the capital does not have that facility. And it's not that we have not reminded them. We have reminded them many a times. Because it's like playing with the life of the people here in Nagaland. From many other districts, they come to Kohima to get treatment. So in Naga Hospital, since they don't have CT scan, they are referred to some private hospitals. Now somebody who is not able to walk by himself, people used to take him, drag Kurina Gari Rekina. That's how they do the CT scan and all. How much difficulty the people are suffering. So it's not only Kohima. Recently we have through some reports. See, even in Zonoboto, there is no CT scan. Those are the things that are happening here in our state. And say example like just to get a CT scan, somebody has to come down from 150 kilometers away from the state capital. They have to travel a long distance. I'm just citing an example. Okay, there are so many other equipments, medical equipments, which I don't know the name also. It is not being provided here in our state. Now I just want to say, how long will this happen? Why? Because see, Nagaland is the state which got statehood before all other Northeast states in Nagaland. I mean, all other states in Northeast. Nagaland is the first statehood pala first. But why? If there is a health issue, we don't get treatment here in our state itself. We have to go to Impal. We have to go to Shillong. See, taking example of Manipur, Meghalaya and all, they got statehood only after us. There is something wrong with our system, isn't it? Through this press statement, I just want to remind the ministry concerned also. This health issue should not be taken lightly. Or, see, example like, there are 56 PHCs without even a single doctor. 57 PHCs without even a single doctor. How is that possible? See, one PHC, it takes care of more than 20 villages. At an average, it takes care of 15, 16 villages. So, without a doctor, how is the PHC supposed to run? Bustide thaga manon 13, 14 village. If there is an emergency case, where do they go? That is the condition or the situation, the pathetic condition of our state today. So with this, I just want to tell the government also, stop taking the healthcare very lightly. Why not our state be like our neighboring states? We always see that there are some issues, there are some conflicts happening here in Manipur, but their technology is much, much better than us. They have medical college, they have engineering college, they have good medical facilities. Now, what is wrong with our state? Okay, now that is concerning the first point, the lack of basic equipments that exists here in our Nagaland. Now, the second point is lack of medical staff, lack of doctors, lack of nurses, all those things. Now government may take excuse. Now why is the medical department not functioning properly? They may make excuse that exams are not being made to be conducted. That may be their excuses. Yeah, for many years they have not advertised the post of doctors, nurse, staff, all those. They have not advertised. But it is their own making, okay, I will tell you. There are lack of doctors everywhere. And they will put the blame on the public, or they will put the blame on some associations or unions for not letting that special recruitment drive to happen. But it is all their, like I'm saying, it is all their doing. See, the reason there were many associations or unions who were against the special recruitment drive of 288 vacancies, which includes doctors, nurses, technicians, radiologies, all those. Now, going back to the first point, see, here example like in Zinomoto, it seems there is CT scan or all those facilities are there. CT scan is not there, but other facilities are there, but they don't have a radiologist to operate the machine. Those are the things happening. Now, see, they will say, government will make an excuse that they are not able to fill up the vacancies because of some certain associations, but it's never like that. The reason here is, in that special recruitment drive, they have said that they will give 175 extra marks to people who have worked during COVID time. Now, I think that is too much. It is almost like 36% of the total mark. Now you imagine yourself, you get 36% mark even before sitting for exam. How fair is that? Now, for COVID, some other states like Manipur and all, they have given a little mark to those people who work during the COVID. Say example like 10 mark extra. That is somehow acceptable, okay? But directly giving away 175 is not acceptable. And it is against the rule number 9 clause 4 of NPSC also. And it is against the rule number 16, article 16 under Indian Constitution also. It is a violation of that. So they may have excuse that because of so many things they are not able to advertise those posts in a like with you. Could be 2020 they gave an advertisement of how many posts? They gave advertisement of 186 posts. And clearly it is written that it is purely a contract for 12 months and no person has the right to ask for regularization. It's mentioned in the order itself. Now, don't think that I'm against those people who are already working, who work during the COVID. I appreciate their work. Will be, say example, just taking example, my friend, let's imagine he is a doctor, I myself also. I work under government of Nagaland. He work under private during the COVID. Now when we are going to sit for exam, I am already given 175 mark extra in advance. Where will he go? Now we are humans though. See, those are the things. But still then, if the government was serious enough, it is already more than 1 year. They gave the order for special recruitment drive, but since many of the pressure group were against it, they were not able to conduct that special recruitment drive. Now it's already more than 1 year. What are they doing? They will have assembly. What resolution do they pass, or what benefit do they give by sitting in the assembly and discussing? These things are very serious, so they should actually be taking up these issues. So for us also, what we are saying is, at least the cabinets could sit, the cabinet could sit, have a meeting, and come out with some resolution. Make way for vacancies, make way for all those vacancies to be filled up. Like I'm saying, see, 175 is not acceptable, and I don't think that will happen. So, at least they have to make some arrangement, isn't it, if they're serious enough. And they cannot simply say that because of the associations banning this special recruitment, they are lacking in manpower. So, like I'm saying, serious enough asi kuli tu pila wartahan discuss kurina ekta adjustment huli kurina special recruitment drive to huli paro thakisula. Really, they are not serious though. Health sector to khatam hui jawale je nagalin la. Example like minor heart surgery to pi na pare nagalin de. Na pare though, you have to go to some other states. Minor heart surgery to pi na pare. Why is the condition like this? The government has to take this issue very seriously. Yeah. Yeah, please.
It's such an injustice, and it's such a tragedy that in this age of so much technology advancements in the medical field, here we don't have even the most basic of equipments. Of course, some private hospitals might have it, but as we know, the majority of our population are farmers. They mostly live in the rural areas, and it's a very big difficulty for people, especially those who live in the rural areas. There are certain diseases or ailments which can be so easily managed if it was given attention, treatment at the right time. But because of all this lack of basic equipments in most of the places in Nagaland, and because of these shortages of manpower, these minor ailments or diseases becomes worse, it becomes chronic, and so many people in the state are going through these difficulties. And of course, there are so many departments, there are so many sectors, but certain sectors like the health or the medical sector, and certain sectors like, for example, primary education, these things we should not compromise on. The government, it's the duty of the government to ensure that at least these basic infrastructures, basic utilities are given. There shouldn't be any excuse for all this. No excuse is good enough. These are basic things. It should be available. If our neighboring states, forget about other states, or if our neighboring states can have all these facilities, why can't we? This is just a matter of lack of accountability. This is a matter of misgovernance. This is a matter of utter and total neglect. So if you have nothing more to add, I think that will be all for today. We'll go to questions.
Specifics like Mr. Gat said, some specific particular hospitals where there is a lack of staff or doctors or nurses, or any particular hospital which like because we have, of course you have mentioned Kohima, Naga Hospital Authority.
Acha sir, agi mo ko nisna exact number do say 57 PHC na no PHC do doctor ekta piswi nai. Aro ite example like ki piri nisna mokchum nisna noliwi zulbuto nisna ito handu do example basic equipment mu ite kwala handu nai do. Na.
Aro staff kan
kan bi ko nisna kumba example like kumba PhD du nurse ekta ba chula ase na doctor na thakra ba nurse ekjun dujun ba chula ase inala pathetic condition aso aro mala problem ase kile health care ge interest na de moi tu na buji aro as per some report every year between the year 2023 to 25 bitore the department has spent between 40 to 240 crores 40 to 240 crores in upgradation of the equipments quasi only I don't know where they have upgraded
That's a big margin, 40 to 40.
yeah but they are not I don't see anything upgrade wala tu na dikhe
Ministry of Health and Family Welfare, Government of India, they directed every state to give preference to those COVID doctors. So I think your disagreement with the special recruitment drive is against, not directly against government of Nagaland, but against the Union of India, government of India and Supreme Court.
Acha sir, see regarding that one, we are not saying that we are against that. Nah, as a party, we are not saying that we are against the special equipment drive. We have to think it practically. I already gave an example, isn't it? Tai private te kam grise, my government te kam grise. To same time de life risks kuna COVID time de kam grise. Na, we example since my government te kam grise, to my gido 175 my extra days. So based on that order that you have mentioned now, other states has also come out with some special recruitment drive, but the marks allocated was not as per the state of Nagaland. Moi conditional. Madhipura National
Government of India never specified any particular marks to be given.
yeah, that's why Hulvi Nishna special recruitment drive la de marks man divi guna ko likhe na ro tu tu yatela making is so tan ni jo bana example like बार क्वाजुली मणिपुर भी तांदी कोविड वायरस खन थैसे डॉक्टर्स खन इदोन किदो अंडर तान NHM दे नली डिपार्टमेंट लादे काम गुरी थगान किदो 10 मार्क्स निसना एक्स्ट्रा दिसे को तो 10 मार्क्स जु गुली दो
The same advantages should be given to those private doctors also.
yeah because they also sacrifice no and it is going to be through Nagaland Public Service Commission so when I get a coalition, if 175 is given to somebody, it is a violation of the Article 16 also. Equal opportunity in employment. So, no. It will be violate. So, NTSC rule number 9 clause 4 will but violate crazy too.
Yes, sir, that's all true. And it has been made.
But in short, Nazir, see, what I want to say is, whatever it may be, rules can do they are the one who are meant to make the rule how a state is governed no the cabinets so itela special recruitment drive ladu chadi really they can sit today if they are money concerned enough they can sit today they can have discussion make some arrangement na marks la huli ina huli do union association na bi chuchap thaki jao huli they are just to order to follow kuruli pare na implement kuruli pare na ini na pending ni rakhe so
It's been 4 years since 8 doctors have been recruited through NTSC in Nagaland. So right now they have this do sources can provide stuff though. Yeah, recruit to one the parato do this particular case do High Court ASM. So until the verdict comes out, more recruitment can be done through NTSC. That's why you ask. So that they can comment.
na moi conditioner sabi honestly kim so to government do na dimag to bal site do na bia site extra chulai do tai example man kyo ekta kam gule court case kuri do court pra stay order ani do itu gane jamala huna jaje ite example like special recruitment drive kro buje some aggrieved doctors they have filed a court case against this also kuli conditioner if government is very serious enough Nagaland rules and regulation who makes the cabinets na mentioning again and again if they are serious enough tonight this evening also they can sit they can frame all those criterias what are the things or what changes need to be done in the special recruitment drive and they can advertise tomorrow that is the power of cabinet na but they are not doing it so we are here to remind them the seriousness of this issue.
Sir, there has not been requisition of medical officers to NPAC for the past 3 years. Why is a medical department not able to requisition post of MO medical officer to NPAC instead of trying to regularize those COVID doctors? And it is clearly written on the contract that is for the 2 years.
See, actually, the story is like this. Even before COVID came, there were around how many vacancies? 24 MOs like that were vacant before this COVID came, and they already sent the requisition to NPAC also. But I don't know why they did not advertise. The reason NPAC gave was the one order came from the government side again, from the department, to withdraw all those. Now again after that, after the COVID, this contracted thaka ola khan nolibi ito hamra sob melai gina special recruitment drive gina ekta ahisu. To tando ito special recruitment drive la excuse to lui gina aji tok to advertise hole na pare se. To because of that court case yate lagai dise ekjumra tadewa dusra lagai dise ina hui na pending ho so hule moi kwa nisina example moi wa court case kursi guli if the government comes out with something which is fair enough for the society or for the aggrieved doctors and nurses, I'm sure they will withdraw the court cases also. To moi ita kwa nisina tahan kwa se NPAC they through dual also the NPAC they jaw lagi to hando because their pay scale is more than 2,800 na huliwi kwa nisina government la making hi ase manu la dimag wa khelu le na life sector to pi mala health sector to pi na khele so it's not a new issue na already punchina thakise huli aw wapas lilu ji tagan
Sir, koiki contract doctors kan naka statement naka insubmit dia naka insubmit to COVID data kan ke July gina ita to ulo na chara do tan kushi na pai je whereas itia medical experience kan be kumpa private hospital de bahar de olibi out of Nagaland de olibi alag civil societies kan olibi COVID la time de as a COVID warriors of mono contribute kure gina se nijor la level pra to idu excuse takan di gina regular guru le takan koshis kura ka to itu is it fair enough for medical medical experience?
It's not fair na. See, I'm not against people who are working in contract, okay? They sacrifice their life for the people during the COVID. Only what I'm saying is equal opportunity given at tahan kile regularization mangi is mo dito ko aso. Our medical doctors kan do tahan la age limit to 45 aso. 45 years tok exam diu pare do tahan. The government is even agreeing or they are agreeing to increase the age also. Only moi kwa nisna loophole kumba se. For me, I feel that ite amni question hudi je tone utu contract bitode kumba the minister MLA hala bachan noli manon thakiuni gi itu garne itu issue la se. Noile do bar kozuli tai private kam usimu government kusi tai life risk kusi to tai kina feel bro 175 mugi extra advance ba diye se. To 175 no na alok negotiate kuru na mark to ina ole tai bi man objection na kru la na to will we order we clearly likhina je moi kwa nisina 24 June 2022 la dibi nobody will mane those posts is only for 12 months until those vacancies are filled through NPAC no hilibi and nobody has the right to claim for regularization clearly likhina je department la advertisement de. So if we say like this, it may sound that we are against them. They can always sit, for example, na. But why ask for 175 extra mark? So maniki police no tan medical. Mano magi head kuli pare they may head us uli condition for equality, transparency. It we kuta kwaze.
So last month there, insurance doctors get Hamra. They have a statement like that last month. I think last month, February next month. So they Hamra for the still the same concerns that they have, lack of doctors and nurses. After that same statement they came out in favor. It seems like he came out in favor of that the one-time special recruitment drive. Now,
Sorry, Kiki association huli ita like you have mentioned, Nidahando tan nijobi, they are working under the department, and they have pointed out so many things that are not in proper way within the department. No, no. If I'm not wrong, they have mentioned all those details, lack of manpower, lack of facilities. It also kuina. But regarding them supporting the one-time special recruitment drive to Moidu to Nazine, will you qualify Balra Babishi Kulido fear Hule Sikulido Moi? Example, Kudishi Bishi Boy Kudishi. Example, fear Hule Sikuli government be a lot negotiate when a marks can huli, pat advertise Kudili Bishi Bal holding it was it.
Question is to the chairman, research department. So, sir, India apni kushi ke 57 PhD though without doctor as in Nagaland. So, out of 100, almost 150. So, sir, apni kan 57 primary health center de apni kan practically visit kuri session, sir.
Now, to the as per the reports, man,
Now, apni kan laga findings kan to sir, kya apni academy kushi. So, NPCC bra government ke ki kobo muna se. What should be the modalities that government should do to execute, to implement and bring doctors in all the PHC? What is your advice?
see, my ini calling mo tagaro sir. A lot to serious ho lagi health sector as it. Nan hoy, alak department nishna no hoy. Example like PWD nishna hole manpower kumti hole sama hui jaw la. I don't know whether I'm correct or not citing the name of the department. Hole health lalu सबसे important is no health first ahead हो ना. तो itu example like 57 doctors na punche guado example like itia 288 vacancy है तो itu pat fill up करियो ना. 288 to doctor nurse itu सब पासु तो example PhD tadi 57 doctor nai तो itu भी सब fulfill हो जाओ ना होय. Para तो concern करी ना itu special recruitment drive अपनी नाम की दिलुई तगन কিবা একটা কৰি না ফাট ইটো ভেকেন্সি টো ফিল কৰিব লাগে আৰু এভৰি ইয়াৰ পইচা ইন টাৰ্মছ অফ 1000 crore ইনভেষ্ট কৰিছে আপগ্ৰেডেশ্যন কু দিছে ফেচিলিটি গান অলপ সিৰিয়াছ ল'ব লাগে তা আমি নহ'লে তো নট এভৰিবডি হেজ দ্য মানি টু গ' আউটসাইড লাইক দেম না ফৰ এ স্মল মিনি হাৰ্ট চাৰ্জাৰী ইউ হেভ টু গ' টু Kohima I mean you have to go to Delhi.
So, apni kan 4th May 2024 you have reminded the government to take action good on it. So, NPCC do you have any plans that medical concern ministry ke log paigina idu apni kan public law grievances to talaga table they put up for
See, Jonathan look at the meeting rule na la kuthabi no. If they don't listen to what we are saying, we will be compelled to go down to the streets. It was as simple as that.
Acha sir, my question is
I think what you have stated so far, I'm assuming it's based on anecdotal references. But to force someone, especially the government, you need hard evidence. So, you need to investigate, RTI can file information to online, study page, government force correct, RTI
See, ajikali the RTI we easily manipulate kuri diya mano. No. And many of the people misuse RTI also. Oh, of course, if required, we can do it. Facts and figure. Wait, for example, was a manpower committee. Itu the moya ajuman kiki kuje itu we they should learn from this. Now number 2, CT scan na punche kusi na moy. Kudi na punche tu evidence lagi we na lagi China sa na hospital din nai do. Tu itu sai na tan action lo lagi do. Aro kudi na punche. What I want to suggest the public also apni la jakari na punche gulu mangi information divi we will take up the issue. These days RTI also easily it can be manipulated na.
Acha sir, my question is
I think what you have stated so far, I'm assuming it's based on anecdotal references. But to force someone, especially the government, you need hard evidence. So, you need to investigate, RTI can file information to online, study page, government force correct, RTI
See, ajikali the RTI we easily manipulate kuri diya mano. No. And many of the people misuse RTI also. Oh, of course, if required, we can do it. Facts and figure. We take for example ko je manpower committee. Itu tu mo ajuman kiki kuje itu we they should learn from this. Now number two, CT scan na punche kusi na mo kuti na punche tu evidence lagi we na lagi China sa na hospital din nai do. Tu itu sai na tan action law lagi do. Aro kuti na punche. What I want to suggest the public also, apne la jaga din na punche gulu mangi information divi. We will take up the issue. These days RTI also easily it can be manipulated na.
So, just supplementing to my colleague, India Parishina, sir, evidence is very important. Apuni kan hoy public law grievances kaune apuni kan hala kori ase buji ase ori sir apuni in the coming days NPCCB itu medical department laga labs district te taka apuni kan bi congress laga district te ase sub office to taki apuni kan ini crown report jayegina sir evidence ola bole pabana ase na nai.
Of course, yeah. Itu tu kru lagi. Itu example like man China sukua dikhe to example like duita tinta jaga de district na thakala. Huli lagi si gulu to man puila time diwi na kure no. Example like not only the medical sector, we go to from district to district. Aro manu babio moi expose kure la to moi kila hota im na longi oppose kore na bi babi tego na no. Huli we went to his place for some work. Tadi last scheme bishi thakisi to expose kuse ite to kam du shuru hua so just because we raised our voice against it kam du shuru hua se itu nishina mal aji medical department labi ko ase I'm sure they will respond mula hisab te nohile to moi agi de ko nishina evidence bi collect kurugo lagile we will go down to the streets na.
So India medical laga topic no itu alag topic ase DCC bura town hall laga issue take up kurise. And then they have evidence on the RTI findings that Hindu 19 crore 90 lakhs 99,999 bilaise itu DCC work paise bishi bilaise itu ba dan logote takan koina ase ki sir ekta special team find form grobo lage where DCC be include grobo lage aru itu pa investigate grobo lage ko to NBCC work ki koi dula pore. See, I'm sure most of you were there during the other day's press conference. Takan DCC kan ye inaka issue as a corporate DCC kan ke interest crucial. They filed the necessary RTI. And they got a reply. Based on that, they have given a detailed press conference. I won't get into all of that. All I can say is. The NPCC is completely behind the DCC, and through this platform, I urge the government to take this seriously and do course correction.
So all have the proof already, everything from the RTI report. What's the next step apart from just telling the government that to give a explanation for it? There should be a legitimate step forward. Approach the CBI, write to the CBI.
Yeah, of
for
course.
investigation. Will that be done?
Of course, everything is being considered. I cannot comment on that now, but we are doing whatever is necessary now. The PCC will discuss about this, and we'll decide on what the next course of action will be. MP Superman Jamirra, MP LTP district Kunbage ambulance community use kuruli dina se tate kunba district ke gather through tribal apex body kan udishe police sir ami kan itia kunba complaint by ase ke those vehicles to district takan laga allocated area din hoina district hospital dimapur de abandoned gurna bishi rakha huni ase so research department rabi do ek par office abole laga ekta abana asna na ek par tani munde.
Acha itulah tu moi terus panggil ku nak hudi nak video saya on his behalf because he had good intentions to give ambulance to all the districts. So far it has been delivered in 6 districts only. So as per his plan, he wants to give it to all the districts. Already even before he said publicly, I'm saying that okay, I'm sorry. inala so that is what he is planning aro কোৱা নিচিনা মেডিকেল চব জেগাতে মেডিকেল প্ৰব্লেম আছে এইটো কাৰণে তাই এম্বুলেঞ্চ দিছিলে আৰু ডিমাপুৰতে জমা কৰি আছে এইটোতো ঠিক নাই ওলা এইটোতো মানে এইটোতো মই লাইন পি চি চি চাইড পৰা হ'লে এনেই ইনকুৱাৰী কৰি নাই কি কৰিব লাগে কৰিলে ভাল না নহ'লে ইট ইজ মেন টু বি ইউজ ফৰ পাব্লিক ছাৰ্ভিচ নট টু বি ষ্টেচন হিয়াৰ ইন কোহিমা ইন ডিমাপুৰ না চব কি দিবলৈ আছে তো
এতিয়া লোকসভা ইলেকশ্যন পাছতে লন চিট কংগ্ৰেছ খান জিতিছে আৰু আপুনি এতিয়া আগে দেখুওৱা নিচিনা ইলেক্টেড মেম্বাৰে পূৰাবে ডিষ্ট্ৰিক্টে ফাৰ্ষ্ট ফেজ এম পি এল এ টিবিলাক এম্বুলেঞ্চ দিছে আৰু আপুনি কৈ আছে অল 18 ডিষ্ট্ৰিক্টছ পাব বুলিবি এতিয়া এম পি একটা থকাৰ পৰা আপুনি আহা চামেৰে কংগ্ৰেছ খানবি ডিষ্ট্ৰিক্টে কি কাম কৰি যাবলৈ আছে প্ৰগ্ৰেছ কেনেকুৱা চলি আছে অলপ আপডেট দিব ছাৰ
See, for us to see, we believe in issue-based politics. Aro ini mami ni dikhe hoy seniors kala blazing lage only mostly Congress to man itia youths kan melai gina public la issue kan take up na not only promising pila de manual train nisina false promises kurina ahala noina even if we don't have a single seat in the NLA. We're acting the role of an opposition till today. If we are not acting the role of an opposition, who will ask question to the government? No. We ask question to the government. Aro itu pichide kina ko itu we tan respond dire. To man opposition la rule he play green ahe se ji. Aro in this so far it is going very well. Dimapur DCC hambi membership drive krise and I hope. Very soon mala PCC la directive ahile do sub district bi membership drive bi thagiola aro moi kwa nichina we want our party to be issue based politics not that false promises wala itu is
basically there are different phases to a campaign and as political parties we are always on campaign mode in a way now what we are concentrating on now is to revamp and rebuild the party. Whatever we have observed from the assembly elections, last assembly elections, we have observed, we have studied, and we have, identified some loopholes. We are trying to work on that. That is number one. And beyond that, we'll continue to raise the issues that are close to the people. We'll continue to raise the misgovernance of the government. We'll continue to, highlight the corruptions of the government of today. But apart from that, we also know that we need to find solutions. That also we are working on a plan. We will continue to give hope to the people. We have a vision for the state of Nagaland. So all these three things are going to go in tandem in the next 3 years. Any more questions? Thank you.